Hi, my name is Maureen Lohan. I'm a chartered physiotherapist specialising in women's health, and I'm a Pilates instructor. I use Pilates-based exercises for a lot of my home exercise programs, and one of the common questions I get from clients in postnatal classes or my patients in my clinic is, when can I get back running? So early last year, 3 physiotherapists, Tom Goom, Grania Donnelly and Emma Brockwell, produced a really nice guideline where they gathered all the evidence, all the studies that are out there, and they combine that with consultation with loads of experts in the area of sport, running and pelvic floors to give us good advice about returning to running postnatally. So overall, they advise waiting around 3 months. They acknowledge that everybody's individual. Some people might feel like going back a bit sooner, some later on, but there are some really important considerations to take into account, whether or not you had a normal vaginal delivery or a cesarean section. So first of all, how do you feel? Do you feel good? Are you getting sleep? Are you eating well? Do you feel recovered? So really important that you only go back running when you have that energy to give, because you'll be using a lot of your energy for just looking after your baby. Also, considering your pelvic health. So how is your pelvic floor? When you're running, there are big forces coming up from the ground through your legs, through your pelvic floor, and we need to make sure that your pelvic floor can hold these forces, can absorb these forces. So one of its main jobs is to support the pelvic organs. Another job is to keep you continent. So if you have any problems with your pelvic floor, or if you're in any doubt about your pelvic floor technique, it is definitely worth your while going to see a physiotherapist who is specialising in pelvic floor, and that will be definitely time well spent. Okay, as well as that, just making sure that your core is strong. So following gentle rehabilitation core exercises, so building yourself up gradually until you're strong enough to go back running. So what I'm doing in this video is I'm using the exercises that they've outlined in this guideline and putting them into sort of a live plan. I've picked the higher intensity exercises. So these exercises for anyone who really is ready to go back running. So you're coming up to that 3 months postnatal, or you're feeling really good. You have put some time into your pelvic floor and into your core work, and you're ready to take on these tough exercises. So either use this exercise program as a test to see where you're at, or you could use it as a cross-training session, maybe while you are running and taking your day to look after your core. So I hope you enjoy it and have lots of healthy miles of running. Thanks a million. So this is my best attempt to bring the clinical advice and guidelines into an exercise program based on what our experts are saying. So we're going to roll the shoulders and roll again. Tuck in your chin, reach down towards your toes, breathe in, and on the breath out, slowly tuck in your tailbone. Take a breath in, and on the breath out, tuck in your chin and roll down and come up. So use these exercises as a test for yourself to see if you're ready to go back running, or if you're already back running, use these exercises to kind of catch up with the things that we're saying you should be doing. So roll your right shoulder, slide down, reach your arm up over your head, get a good stretch through your ribs, breathe in and come back to the center. Roll the other shoulder. I'm adding in some of my own exercises as well, based on what I use, what I find good, just for holding onto range of movement and strength. Roll your shoulders, bring your hands onto your pelvis. We're going to bend the knees and pelvic tilt, round your back and arch, round, back and arch. Come into halfway position and straighten up. Bring your hands in an inch and down an inch. Glide your shoulders up towards your ears and glide down. Breathe in and breathe out. You're going to activate your core. So pulling up through your pelvic floor, feeling that gentle switch onto your tummy muscles. No clenching, no breath holding. Hold for 8, 7, 6, 5, 4, 3, 2, 1. And I'm not bringing pelvic floor exercises into this assessment. What we're doing is testing. So if you find this pelvic floor weakness, get back doing those exercises. You should probably be doing them anyway, or have them done. Okay, we're just going to go and do some heel raises. So lifting and lowering, and go for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Kick out one leg and just do some circles at the ankle and change direction. Good stuff. Kick out the other leg and do circles at the ankle and then change direction. Perfect. We're going to go into single leg heel raise. Okay, so we're lifting and lowering, and we're going to go for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch the other side. So the guideline is saying we should be able to do around 30 heel raises. I'm just going to break them up into 3 sets of 10 for now. It's my first time going through all the guidelines in an exercise program, so I'm working with you and alongside. So switch to the other side, go again for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and switch to the other side, go for 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Switch again and go for 10, 9, push up each time, 8, 7, 6, 5, 4, 3, 2, 1, and switch again. If you're doing this exercise a second time, try and keep going. Try and do all 30 in one go. Actually doing the third set here, it probably is manageable. 4, 3, 2, 1. Kick out that leg, get a nice circle through the heels and change direction. Well done. Kick out the other leg and switch again. Changing direction. Perfect. Bring your legs just hip distance apart. We're going to go into some squats. So starting with our double leg squats, sit right back and push up and go for 8, 7, 6, 5, 4, 3, 2. Next one, hold down and pulse. That's it. Holding nice and low. Hold that squat. Bring the arms out wide, circles forwards and circles backwards. Come down an inch, circles forwards and circles backwards and down an inch, circles forwards and circles backwards, and push up, giving your legs a nice little shake. Okay, we're going to go into single leg squats. Okay, so we're just going to kick out one leg, bring your hands in front, sink down nice and low and push up. And we're going to go for 8, 7. So the things to watch out for with these single leg squats is that your knees aren't flicking outwards, or more importantly turning inwards, because that can be a sign that your glutes are weak, and it could just be a sign that you might run into problems with your knees, hips, anything like that. Go for 3, 2, and hold right down and pulse, pointing out that lower leg. That's it. And push up, give the leg a nice little shake, and we're going to go to the other side, kick out the leg, and off we go nice and low through that squat. Again, paying attention to your knee position, trying to keep nice and balanced. Side to side, go for 6, 5, 4, 3, 2, and 1. Give the legs a shake, switch back to the other side. So I guess we're running a lot of single leg activity. Each time you land on your foot, you're sending that chain reaction up through your knees, your hips, through your core. So just making sure that that single leg is able for it. Go for 4, 3, 2. Next one, sit right down and pulse into it. Hold it there and push up. Give the leg a little shake and switch to the other side. Kick out the leg, hands in front, sink down nice and low and push up and go for 8, 7, 6, 5, 4, 3, 2, and 1. Hold down and pulse. That's it, and come up. If we're going to the trouble of doing 2 sets, we may as well do the third set to really see how strong we are. Bring the arms in front, sink down nice and low. So you're looking through these exercises as well to make sure that you're not experiencing any pelvic floor issues or back pain, or if you do have symptoms of prolapse, that they don't make them worse. So these are high intensity enough exercises, but they reflect the demands that are needed for running, because you're sending good forces up through your body. Switch to the other side. I think it's 2.5 times your weight in forces that comes up through your body when you're running. We're not sure if the pelvic floor is absorbing all of that or just some of it, but we know that it is more demanding, and it's increasing the pressure through your tummy as well, creating that downward pressure. So the pelvic floor needs to be up to it. 2 and 1. Give your legs a nice little shake. Well done. Just give the pelvis a little circle, a tiny little breather. Good stuff. Okay, so I'm going to do some lunges. They're not in the guideline, but I think lunges are really good for overall strength, really good for your core, good for your posture. So giant step back, hands in front, leading with the back knee. Getting a nice stretch through that back hip. Go for 8, 7, 6, 5, 4, 3, 2, 1. Switch, leading leg, and off we go for 8, 7, 6, 5, 4, 3, 2, and 1. Come back to the center again. Give the legs a nice little shake. Okay, so we're going to do a little bit more on single legs. So bring in one leg in front. Going to reach forwards, kick up the back leg, drop your chest, and now bring the back knee forwards as we lift up. Okay, reach forwards, drop your chest, and bring your arm up. So we're just going to go opposite arm, reaching forwards, and then bringing the knee up in front. Opposite arm, reaching forwards, and then coming up with the other arm. So we're just bringing in more of a single leg running movement. So your leg that's straight on the ground, the opposite leg is reaching forwards as you come forward to bringing up the opposite leg. So reaching forwards and coming up. Nice balance challenge. Go again. Let's go for 5, 4. That's it. Oops. 3. Oops. 2. And 1. So a lot of work through that lower leg. Give it a nice little shake out. Switch to the other side. So we're going to reach forward. So starting off, if you're finding hard, go really slowly, drop your chest, then push back with the arms, bring the knee up in front. So it's a good way of building to the single leg fast exercise. And I could probably do spending a bit more time in the slower one myself. Then bringing it up into opposite arm, lifting with the front knee, and then reaching forward. So we're bringing in that kind of more dynamic movement. That's it. And go for 7, 6. So there's obviously a bit of learning in it because I'm finding it a little bit easier even second set. 5, 4, 3, 2, and 1. Good stuff. Let's just do another set on the other side, kind of to see, does it get easier? Does your body remember it pretty quickly? Let's reach forwards and come up. Go for 6. No, I think it's just a bad leg. 5, 4, 3, 2, and 1. Switch to the other side. So reaching opposite arm, opposite leg, and come up. Go for 6, 5, 4, 3. Actually, I'm going wrong coordination wise. 2, and I've lost the balance, and 1. Good stuff. Give your shoulders a nice little roll, tuck in your chin, and slowly rolling down to your toes. Breathe in, and on the breath out, come up. Okay, just taking a little breather. We're going to do some single leg balance. Bring your knee up in front, bring your arms in front, and hold for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch to the other side and hold. So if this feels easy, bring your arms right up. 8, 7, 6, 5, 4, 3, 2, 1. And switch again. Go for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch to the other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Jogging on the spot is another one for about a minute. So let's just jog on the spot. Okay, so I guess what this is doing is just testing your pelvic floor, making sure you're able to sustain the loads of the increased intra-abdominal pressure as you load downwards, okay? It's not quite reflective of your own running posture, but when you are running, make sure your tummy is nice and loose, that you're not clenching through your tummy. So when you're breathing, your tummy is moving and you're nice and relaxed through the shoulders. We all have our own running posture. It's something I feel we don't need to delve too far into, particularly if you find other things to work on that can create a strengthening effect. So keep going and just running on the spot. Excellent. Perfect. And I don't have a timer on this, so we're just kind of winging it. but you know what you're looking for. We don't want any symptoms of pressure or prolapse to get worse. We don't want you to be leaking. If you really wanted to test yourself, you could do a nice big cough. So just cough, or practice your knack where you pull up through the pelvic floor and then cough. So give it a little test while we're in this position, because you're going to learn loads of information from testing your pelvic floor. But if you know in advance, don't test it unnecessarily. Okay, give the shoulders a roll, and we're just going to go onto one leg and we're going to hop. So let's hop for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Over to the other side. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Give your legs a little shake and take a tiny breather as we come to the end of the mat. So I know on this guideline there's 10 bounds forwards. I probably haven't got the space to see it all, but make sure you have enough space that you're going to bound both legs 10 times. Okay, so 1, 2, 3, all the way over to your own screen. 4, 5, 6, 7, 8, 9. I'm not even sure if I'm banding properly. 10. Okay, good stuff. So again, hopefully feeling good and no symptoms doing that. Okay, so we're going to get down onto the mat and work on some more glute exercises. Okay, so the next exercise then is single leg bridge. So lying down on your mat, hands onto your tummy, roll back, come up into your bridge. Okay, so we're nice and warmed up, so we don't need to start off with double leg. Bring your hands down by your side, slide out one leg. So it's single leg bridge. We don't want you to sort of slouch downwards as soon as it goes single or see any rotation. We want to popped up with the hip extended, go halfway down and push up. So let's go for 10. 9, if you can take the extra challenge, bring the arms up. 7, 6, 5, 4, 3, 2, and 1. Switch to the other side, halfway down and push up. Go for 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. Switch again and go for 10. 9, 8, 7, 6, 5, 4, 3, 2, 1, and switch again. Halfway down, push up for 10. 9, 8, 7, 6, 5, 4, 3, 2, 1. Bend both knees, hug your knees up to your chest. Get a nice stretch through your lower back. Move your knees over towards your right shoulder and over towards the other shoulder. And turn over onto your side. We're going into our last set of exercises. So single leg raises, or sideline leg raises to do, okay? So I'm just going to throw a little bit of clam, because it's something that I see in my clinic often is you've got the fittest people, but they might have very, very weak rotators through the hips. So bringing your hips, shoulders, hips and ankles in line, floating your knee up towards the ceiling. So what we sometimes see is that the body starts to rotate with the hip. So we don't want to see that, just the knee lifting, but it needs to lift higher than the hip. And let's go for 10, 9, 8, 7. And I often say in my own classes, 3 sets, 15. Anybody fit should be able to do it. 3, 2, 1. Give your muscles a thump. And the harder version, bring your foot in behind your knee, drop your knee down, lift right up and go for 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Give the muscles a thump. You might be feeling a little bit of a burn. Let's go for another set. So after doing these exercises, if you find, number one, that they were challenging, then do them again. Make them the thing that you want to sort of get to, or they'd be a really good way of doing cross training. So on your day off from running, that you might do these exercises. Or the other thing to do is aim to get these exercises done, make them easier, and know that you are right to be running, that you are ready to be running. And it's really good to have that study done, that evidence review that lets us know how to consolidate the best information that is available. We know it's not perfect, but really good to have. So give the muscles a thump, straighten out your legs, point your toes, lift up, and toes towards you, drop down. So lift and lower. So sometimes these kind of reviews are done and they're just so useful for clinicians like myself. So really grateful to the authors of this study that we can put together this kind of exercise program and know that it's really solid. Go for 4, 3, 2, hold right up and pulse. And drop. down, give the muscles a thump. And of course we have to switch it over to the other side. So knees bent, shoulders, hips and ankles in line, and off we go for 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Give your muscles a thump, straighten out the lower leg, curl in with the top foot, hand to your pelvis, and go again. 15, 14, 13, 12, 11. So you just have to kind of belt these out. There's nothing easy or particularly enjoyable about them. Go for 8, 7, 6, 5, 4, 3, 2, 1. Give the muscles a thump, and we'll do one set. And hopefully what you'll learn from doing these exercises is good injury-free long miles. Go for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Give the muscles a nice thump. Okay, well done. I hope you enjoyed those exercises and wishing you many, many miles of happy running. Well done. Thank you.